Good evening. This is All India Radio, Kohima. I'm Jonas Yantan with Evening News. The headlines. India's first COVID vaccine for children above 12 years gets approval for emergency use in the country. Health Minister Pangnyu Phom calls on Union Minister Sarbanada Sonowal, highlights activities of AYUSH Department in the state. Deputy Commissioner Thavaseelan asks all village GPs, Chairmen, VDB Secretaries and VGs of the district to resolve issues in a civilized manner. And Union Minister for Labour and Employment, Bhupender, Yadav says survey of migrant workers being carried out due to COVID pandemic. As the nationwide free COVID-19 vaccination campaign at government facilities for those above 18 years is going on, we advise our young listeners to get vaccinated and also help others get vaccinated. We also advise our listeners not to lower their guard as COVID-19 remains a threat to our health. Please stay at home unless it is essential to go out and continue to follow these 3 simple steps. Wear a face mask, maintain 6 feet for social distancing, focus on hand and face hygiene. For any COVID-related information and guidance, contact national helpline numbers 011-2397-8046 and 1075 and state helpline number 1800-345-0019. And now the news. Central Drugs Standard Control Organization (CDSCO) has approved DNA COVID-19 vaccine Zycov-D of Cadila Healthcare for restricted use in emergency situation in India for 12 years and above. It was approved after evaluation of interim Phase 3 clinical trial results in consultation with subject expert committee of CDSCO. The vaccine has efficacy of 66.6% and it is to be stored at 2 degrees Celsius to 8 degrees Celsius. The vaccine is needle-free to be administered intradermally in 3 doses at day 0, 28 and 56. Prime Minister Narendra Modi said India is fighting COVID-19 with full vigor. Approval for world's first DNA-based Zycov-D vaccine of Zydus Cadila is a testimony to the innovative zeal of India's scientists. Union Health Minister Mansukh Mandaviya said Zycov-D is the 6th approved COVID-19 vaccine in India and the 2nd indigenously developed one. Minister for Health and Family Welfare and AYUSH Pangnyu Phom called on Union Minister for Ports, Shipping and Waterways and AYUSH Sarbanada Sonowal at his official residence at New Delhi yesterday. During the meeting, Phom highlighted AYUSH scheme and the activities of AYUSH Department in the state. He said that AYUSH hospital in the interior parts of the state will cater to the grassroots people in the state. He thanked the Centre for AYUSH scheme in the state. Union Minister Sonowal assured that the Ministry of AYUSH will extend all possible help and assistance to complete the project in the state of Nagaland and the northeast states. Deputy Commissioner Thavaseelan said that GPs, Chairmen, VDB Secretaries and VGs in different villages across the district should resolve all issues in a civilized manner or report to the district authorities for amicable solutions of all issues so that peace prevails in the locality. The DC lamented that many villagers, with the active participation of the appointed village heads, are taking law in their hands, leading to loss of property and creating apprehensions and mistrust in the society. The DC warned that all developmental works, assistance both CSS and state schemes will be stopped indefinitely if any individual or groups create problem by taking law in their own hands, which is detrimental to peace and tranquility in the society. Union Minister for Labour and Employment Bhupender Yadav has said that a survey of migrant workers is being carried out due to emerging situation of COVID-19 pandemic. A portal will be launched in the current month for migrant workers where all the workers will be able to get their registration done. This will also provide the benefit of limited insurance to the workers. Addressing a press conference in Ajmer this afternoon on the conclusion of his 6-day-long Jan Ashirwad Yatra, Yadav said that the central government has taken several steps to amend the labour laws. The minister said that government is constantly making efforts to increase the scope of social security in the labour sector. This news comes to you from All India Radio, Kohima. You can also listen to this news bulletin on a YouTube channel, AIR News Kohima. Over 1 crore 2 lakh pieces of jewellery have been hallmarked following implementation of mandatory hallmarking. Mandatory hallmarking of gold jewellery and artifacts came into force in a phased manner from 16th of June with a rollout of 256 districts across India. Briefing meeting on progress in implementation of the mandatory hallmarking, Director General Bureau of Indian Standards Pramod Kumar Tiwari said, "This entire process has been a huge success so far." He said pace of hallmarking has reached almost 4 lakh jewelleries per day. Tiwari added that awareness camps are being held for jewellers to ease this process. Central Board of Direct Taxes has issued refunds of over 49,696 crore rupees to more than 22,75,000 taxpayers between 1st of April to 16th of August this year. In a tweet, Income Tax India said the income tax refunds of 14,608 crore rupees have been issued in over 21,50,000 cases, and corporate tax refunds of 35,088 crore rupees have been issued in over 1,24,000 cases. Twensang District Task Force for COVID-19 held a meeting today with state-level monitoring team for Twensang led by Secretary Duta Anden Konyak and Joint Director Health and Family Welfare Dr. Ahu Sekose. State monitoring team leader Anden Konyak said that if the third wave strikes, it would probably hit the younger generation since they are not vaccinated. He urged everyone to be vigilant in containing the spread of the pandemic. Dr. Ahu Sekose commented on the efficient way of handling COVID in the district. Dr. Sekose viewed that the NGOs and community involvement in testing and vaccination drives, along with DTF and medical department, is encouraging and an exemplary one. Nagaland today reported 72 fresh COVID-19 cases and 108 recoveries. Of the cases reported, 34 were detected from Kohima, 25 in Dimapur, 6 in Mogokchung, 3 from Pek, 2 in Peren, and 1 case each from Twensang and Wokha. Total COVID-19 tally has reached 29,554 cases and 27,099 recovered cases. Deaths due to COVID remained at 595 with no report of death today. State's active caseload presently stands at 994. Nagaland Board of School Education NBSC conducted an interactive webinar session yesterday on how to engage students online. Resource person Dr. Sapna Agarwal, educationist and founder Big Wonder on YouTube, shared on how to have better discipline in online classes, how to make lesson plans for online deliberations. A plethora of activities to engage the learners within 30 minutes of the class time was also discussed. Nearly 800 teachers from registered schools of NBSC from various districts participated in the webinar. Wokha Circle Students' Union WCSU, comprising of all its units, and Wokha Town Council WTC, organized Cleanliness Cum Beautification and Plantation Drive today at Zamang Lake under the theme Let's Keep Zamang Lake Clean. ADC and Administrator, Wokha Town Council, T. Langosen Zanglao, in his short speech, assured of all possible help in keeping Wokha Town clean and encouraged the students that such kind of initiatives is a stepping stone towards greater work. The union planted flowers, ornamental plants, and other varieties of tree saplings. The union also put up a signboard and urged the public to keep the lake clean and make it everyone's responsibility to keep the Zamang Lake clean and beautiful. And now to the news, here are the main points again. India's first COVID vaccine for children above 12 years gets approval for emergency use in the country. Health Minister Pangnyu Phom calls on Union Minister Sarbanada Sonowal, highlights activities of AYUSH Department in the state. Deputy Commissioner Mon Thavaseelan K asks all village GPs, Chairmen, VDB Secretaries and VGs of the district to resolve issues in a civilized manner. And Union Minister for Labour and Employment, Bhupender Yadav says survey of migrant workers being carried out due to COVID pandemic. That is all we have in this evening news bulletin. Good night.